I am here to talk to you today about symptom management and side effect profiles regarding chemotherapy, immunotherapy, and biotherapy. Your provider, your oncologist, your clinical pharmacist, your nurse navigator, your clinic nurse, and a team of dietitians are all working together for protocols that are specific to your cancer and to your treatment plan. Chemotherapy affects all cells in the body. When this happens, most side effects are often managed with medications and medical care. Many times people experience fatigue. First of all, we want to make certain that you prioritize to do activities when you feel your best. And typically that's after taking a nap. Kind of allow your body to tell you what to do. Walking helps. Yoga, stretching exercises. Now let's talk about loss of appetite. When you're taking chemotherapy, when you have cancer, you do lose your appetite. What we want you to do is what we call graze eating. Small, frequent meals, up to 4 to 6 a day. Things that are high in protein are the things that you want to eat. And then supplement your diet with protein shakes, things of that nature. You'll get lots of pre-meds, lots of nausea medicine prior to your infusion. And then typically they'll send you home with 2 different nausea medicines, and you can alternate those to see what works best for you. If you're vomiting, you're no longer nauseated, you're vomiting. So we encourage you to take those medications at the first sign of nausea. 3 large loose stools in a day is considered diarrhea. We give many drugs that do produce diarrhea. There will be different things that your physician, your nurse practitioner, and your clinic nurse will tell you to take for those things. If you're taking Imodium and you're still having diarrhea, that is a call to the clinic just so we can arrest those things. Some of the chemotherapeutic drugs can cause a great amount of constipation. You should not go more than 3 days without a good moving of your bowels. With constipation, you want to monitor for intense abdominal pain. You've gone more than 12 hours without urinating. Your urine is dark. Any excess gas, any bloating, anything that is not relieved by all of the modalities that they provided for you. If that happens, you need to call. Patients that are on therapy can really dehydrate quickly. So make sure that you're diligent to drink your water. The recommendation is 8 to 10 8-ounce glasses of water a day. So make that a goal. Hydrate, hydrate, hydrate.
I'm going to go over a few more side effects you may experience during your cancer treatment. One thing that you may experience is mouth sores. We want you to check your mouth daily. Look for things like sores in your mouth or in your throat that we call ulcers, any dryness, changes in saliva, difficulty swallowing. We want you to brush your teeth daily with a fluoride toothpaste and a soft toothbrush. Don't use any over-the-counter mouthwashes because those could contain alcohol and other harsh chemicals that could damage your mouth. We want you to use baking soda and salt rinse that you can mix up yourself in 8 ounces of water with half a teaspoon of baking soda. Swish it around in your mouth for about 30 seconds and then spit it out. If your partials or your dentures don't fit well, then don't use them during your chemo treatment. When you're preparing your meals, focus on soft foods and use fewer spices. You may experience hair loss, hair thinning, or changes in texture. Hair loss usually begins around 7 to 21 days after your treatment begins, and it's usually temporary. Now, when your hair grows back, it may grow back the same way, or you may have a different color or texture. Report to your clinic any new rash, blisters, peeling of skin immediately. To take care of your nails, just gently trim or file them. Don't get professional manicures or pedicures unless your provider has given you permission to do so. You should avoid prolonged exposure to sunlight. You should definitely wear an SPF of 30 PABA-free sunscreen. When you're washing, use a mild soap and just pat instead of rubbing. Moisturize your skin with a hypoallergenic cream. Bone marrow consists of fast-growing cells, and chemotherapy may inhibit the ability of the bone marrow to produce new cells. Your blood consists of red cells, platelets, and white cells. Red cells help with oxygenation, platelets help with clotting, and white cells help protect your body against infection. Usually the blood counts recover on their own in 10 to 14 days. Sometimes your provider will prescribe an injection to help boost your white blood count. You may also receive blood transfusions if needed. You can help prevent infection by adopting the following practices. Avoid people who you know are sick. Wash your hands often with soap and water. Avoid getting cuts or breaks in the skin. Wear gloves when working in the garden or doing housework. Bathe or shower daily and practice good mouth care. Take your temperature as instructed. We want you to use an oral thermometer, and if it gets to 101 degrees Fahrenheit at any point, go to your ER. Now, if your temperature gets to 100.4, you can wait an hour, but if it maintains at 100.4 or goes any higher, again, we want you to go to the ER. Now, unless your provider tells you it's okay to take aspirin or any other over-the-counter pain medication, we do not encourage you to take those medications because they can mask a fever. Never use any suppositories, rectal thermometers, or give yourself an enema because that could introduce dangerous bacteria into your system. Keep in mind that everyone's body responds differently to chemotherapy. Follow the instructions given by your care team on what to do and when to report your symptoms. Simmons Acute Care can provide you with same-day appointments to be seen by a nurse and a provider for side effects and symptoms from your treatment that would otherwise take you to the ER. Now, these are symptoms and side effects that are urgent but not life-threatening. Simmons Acute Care Clinic is led by providers and nurses who are specialized in cancer care. We have a Hope Line number available to you in every after-visit summary that your nurse provides you with, and it's in your MyChart. The number's 214-645-4673. You can call that number with any questions that you have or to schedule your Simmons Acute Care Clinic appointment. Thank you for watching. We hope this has been helpful, and we thank you for trusting us with your care.